Yeah.
Hello, everyone, and good morning, and welcome to today's session. So, as you know, today's topic is the role of center and present state of mind in understanding a man, and it is a very important part of the case taking and understanding the Sehgal method and how it works and how we do the case taking to understand what is a man in front of you, that is, what is a patient in front of you. So, we will start this 1 hour session today, and hopefully, it will be a very knowledgeable session for you. So, let's begin. Welcome Dr. Yogesh to start the session.
Good morning, everybody. Namaskar. If you are able to hear me. So, friend, nice to see you again on this day. Today, I am going to speak about a topic which I think that normally we never cover because we always talk about rubrics, medicine, cases. It is going to be related to all these topics, but in a different way. In our day-to-day practice, as we grow, one can still learn new things as a habit or curiosity. And as we store our wealth in locker, we hoard the knowledge in our memory to use it later. Some of the practitioners who in the beginning of the practice or in their college days comes to know about new discoveries through seminars, and they may think of applying it once they start their practice, and later they may forget about it and never use the stored information. Then there are some who feel that they need something extra like improvisation, so to have more success in practice. For that, they roam around from one teacher to another teacher or one method to another method and try one by one. As the time passes and they gain the experience from their own success and failure, they start using those things which are promising for their practice and abandon the rest. Lastly, there are some who always look for shortcuts, which can give them short success, due to which they get disheartened and kept on looking for another shortcut. So that is a small, journey about homeopaths. So today, what I'm going to talk about may be surprising for you. First, I would like to ask everyone from you that, have you seen this book? Or if you have this book, if you know this book by heart, which is the first book written by Dr. Sehgal, what I understood that uh, lately, that many of you have been storing the knowledge of rubrics from here and there, and you think that that is enough for the practice. Maybe yes. I believe that you all are successful in your practice. So what should I tell you? So I thought, okay, let me start with little bit more of the whole idea of Sehgal concept. So let us start the journey. As you maybe, I think in the last seminar in Delhi, I think nobody or maybe few of them have idea what is Dr. Sehgal's School of Revolutionized Homeopathy. The old one, of course, they have the idea. Maybe those who are very new or just started learning this method, perhaps they only know Sehgal technique, Sehgal method, Sehgal that, Sehgal that. So Sehgal word is very famous. And with that, I don't know his idea is also so much famous or not, but yes. So friend, what we need to in our practice, first we have to be a good listener. We have to be a good observer. That two things we all need. But what to listen and what to observe? For the newcomer, that is the idea that, when you come out of college, this thing that you have to be a good observer. But what to observe? You have to watch the patient, you have to observe the patient. So there is a classification. There are two words, watch and observe. But we are taught in the books that we have to be a good observer. So observer means that you don't have to observe the patient as a whole, but you have to observe something which is very, particular of a patient, something which he does in front of you. And what you have to listen. You have to listen the story of the patient from the beginning of his life, from the family history, born history, or all this you have to listen, or you listen something particularly what the patient, for which patient has come to you, what he wants from you, in which way he wants the treatment, and then to hit the right target. This is for the physician. He has to hit the target. Now, hit the target means it is very necessary for a physician to first to understand what in a patient he has to target. If I have to target the whole, or if I have to target only the one thing, and then the pyramid will be broken. What to target? So sometimes what happens, we try to target everything in a case. This also, and then what happened? We could not achieve the success. So according to Dr. Sehgal, the hit the target means that first you have to understand where to hit in the case, what point, and then to prescribe with confidence. What I see that for so many years, I have getting students from after passing their college. What they are lacking? They are not lacking the knowledge because they have 5.5 years of studies. They know how to prescribe, and I mean they know the modalities of prescriptions and how to prescribe. What I feel they are lacking is confidence. And when they come to me for example, they say, "Sir, we want to learn from you." So I tell them that only thing I can give you in the 3 to 4 months is confidence. Rest you know how to do, but you don't have a confidence how to gather the things, how to understand the patient maybe, and you are not confident, sometimes if you are able to prescribe or not. So that is one thing which you are lacking. Now, what is happening, I don't know, globally is different. For example, there is a very little modification about Sehgal method in outside India, but inside India there are many modifications have occurred in the past many years, not now. So the way Sehgal method is getting promoted, in many I have been getting kind information, or kind suggestions from who are true followers of Dr. Sehgal that, "Sir, please stop these things. How to stop, because the information is not getting through. So I can't do it. I'm helpless." So what is happening now, that how they are promoting Sehgal method is exactly patient says and selection of rubric. That is wrong. And what is the correct way of understanding the man according to Dr. Sehgal? The patient says, feeling, interpretation, and then rubric. That is our way. Now, if the mental does not improve, it means that the patient is growing worse. There is no better evidence of the good action of a remedy than mental improvement. This is written by Dr. Kent. Now, I don't know that how many of you have understanding of all old authors, like have you read all the Materia Medicas, or have you gone into what we know about? See, everybody says Dr. Kent says, but who follows it? If we really follow that, if we really are looking for the mental changes, not the mind symptom. See, again, every time I say, please don't go on the change in the symptoms. When you are prescribing on the mind rubrics or the mental state of the patient, you must focus on the changes. First start from the mental state. But what we look for, your fear is gone. Are you still getting angry? What about your irritation? So we are not focusing on the mental state. That is missing. So today you will learn perhaps again that when in the follow-up, what you have to do. In the follow-up, we go to the same basics. Though we try to prescribe on rubrics, 4 rubrics, 5 rubrics, gather together, one remedy. And then in the follow-up, we don't know that which of, for example, you have taken 5 rubrics. Now the I can say the worst part or the bad part is in the follow-up, I think what most of the practitioners they miss is that out of the 5 rubrics, which rubric is the center of the case and which has to go first out. If I give them medicine, all the 5 rubrics will disappear, or the mentality will disappear, or the physical symptom will disappear, or the general well-being will come. What will come first? How the patient when he comes second time or the third time or fourth time, it depends upon your first prescription. If you are successful in the first prescription in the first go, wonderful. Maybe sometime 10 times, 15 times. It happens with me also. Sometime I click one time, sometime 5 times, sometime never. So it is a part of practice. We should not feel discouraged that, oh, 10 times I could not find a remedy, so this system is bad. Nothing is bad. And you know that we should keep our balance normal. So, friend, you know that Dr. Sehgal started his journey into this method with three words: common, usual, and ordinary. How he got this idea that uh, he should take the mind symptoms or those symptoms from the patient only related to the mind, not physical. Because in physical journal or physical, we don't have something common, usual, ordinary. Maybe if you go for the physical level, of course, we have something common, usual, ordinary. For example, you ask a patient if you are thirsty. So thirst is a normal thing. Everybody has a thirst. How's your appetite? Everybody wants to eat. So there is a difference between what a patient does and what a normal patient does. So ordinary means what? If you feel thirsty, yes. So everybody feels thirsty. So this is very common symptom. So why to take it? And this is usual. There are sometimes there are usual things like usual activity of the patient. For example, if you do some job, if you work, for example, if you ask a housewife, if you what do you do in the free time or during the day? Sir, I get up in the morning, I make breakfast for the family, I then I prepare children for the school, then I make the lunch. This is usual activities. Still we consider them when a patient becomes sick. So common, usual, ordinary are the things which mostly the people, they show the sign that Dr. Sehgal. And I'm not going to offend somebody, but you know that from where Dr. Sehgal has got this idea of common, usual, ordinary. I think that everybody knows about the guiding symptoms. If I'm right, everybody knows about the guiding symptoms. Yes. Anybody who can tell me that they know about guiding symptoms, and who gave this idea of guiding symptoms? Anybody? You have heard about the guiding symptoms? Raise your hand. Yes, Dr.
Hearing.
Atish. Yes. So what Dr. Herring gave, the idea of guiding symptom? What was the idea of Herring? From there, the clue came. So Dr. Sehgal has taken the clue from the guiding symptom of Herring. So it's not that his idea, but only thing is modified his idea. So Herring, it was not Honeyman's idea. It was Herring's idea. So it means that the improvisation in homeopathy have occurred time to time. Everybody changed. Dr. Kent changed, Dr. Boyninghausen changed. Everybody made their own point in homeopathy, and everybody was successful in their own. So what was the guiding symptom from Dr. Herring? Anybody can say, if they know, if you remember. And then you understand this common, because everybody talk about, oh, Dr. Sehgal says common, usual, ordinary, but perhaps they have no idea from where Dr. Sehgal got the clue. So in guiding symptoms, it was given those peculiar, unusual, and distinctive symptoms by Herring. And what Dr. Sehgal says, it was peculiar, unusual, and distinctive symptoms. And what Dr. Sehgal told, common, usual, ordinary. So he made this change, improvisation. Because I don't know how many are using the guiding symptom according to Herring in their practice. I have no idea. So the important lesson is that while selecting a medicine according to the revolutionized method, you cannot afford to ignore certain expression just because they appear quite common to all patients. Now, what was the argument? When I started teaching in many countries I took the you can say a job of teaching from 96 onward. So it's like I've completed more than 26 years in teaching, and I probably have given 1,000 time lectures on Sehgal method. And I also improvise myself because I study. So the best part of teaching is that I learn a lot, because every time you have to prepare the lecture, you have to do something new, also in your practice. So what was the argument in the beginning that, oh, this is very common symptom. How can you take it? Every patient says like this. How can you say that every patient say that I want to know about my problem? Every patient. So, in the beginning, that was a big argumentative issue, that why you take common symptom? You should take peculiar symptom. We should take those symptoms which makes uh, which helps in individualization. How can a common usual symptom help in individualization? Now, for example, a patient comes to you. Now, what is the best way of practicing Sehgal method in the part of case taking? For example, when a patient comes to you straight away, for example, he starts saying something. You listen. What you have to listen, first thing, that you don't have to listen too much. Only listen first few lines, 1 line, 2 lines, and then make a pause. Stop. Okay. So you have come to me because you have headache. Okay. You understood? I understood. Because you have come to me for headache. For example, patient say, doctor, I have a headache problem. What we assume, that the patient has come to me for headache. Is it true? Maybe not. So how I understand the patient? Patient says, doctor, I have a problem of headache. I have a problem of sinusitis. I have a sinus problem of abdominal disorder. I have a problem of constipation. Now, what is my question? Nothing, no question. I simply ask the patient, so you have come to me for constipation. Is it right? Now, this is now the patient turn. No, 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 no. No, I am just mentioning that I am suffering from constipation, but this is not my issue. Oh, so it means that in the mind, you started to put the patient in constipation, like, oh, you have to treat constipation of this patient. Those you start, you have a constipation for how many months? So if the stool is hard or stop, so you go for constipation, which I don't do it. First, I want to make a patient clear from the patient for which problem he has come to me. Then the patient say, no, no, no. See, constipation is one of the issue. I don't know whether you can treat it or not, but my main issue is, doctor, that because of constipation, my whole life is ruined. Okay. So how your whole life is ruined? I don't know. I don't know how constipation caused the patient's life to be ruined. No idea. So I asked the patient, what do you mean by ruined? I don't understand. And this is very new information. Now, this information is new, that a patient says to you that due to constipation, his life is ruined. Now, this is the first entry. You have to understand that patient says my life is ruined. Okay, so you have to ask the patient, please clear me about the word ruined. Now, maybe he has his own explanation about ruined, depending upon the knowledge or the how much he knows about the word ruined, or maybe he has just listened the word. Maybe he's very well known, he knows English very well, so he used the word ruined. Or maybe he can say that, oh, this problem is spoiling my life. So patient can use one word according to his vocabulary, but we should not take that word as true, because patient maybe has no idea about the word. He just say, doctor, that I'm more worried because of I'm more worried about children. We listen this. I'm more worried about my children. Okay, anxiety children about. But the fact is that if a patient knows what he's saying, most of the patients are not aware what they are saying. So if a patient says that I'm worried about my children, he should. If he doesn't worry about his children, his neighbor is going to worry about his children. No, he had to worry about his children. So what to take it? This is one of the common issue that I worry about. I mean that if there is somebody who says I'm not worried about my children, this is very particular. This may be peculiar if a patient says, doctor, mother says, oh, doctor, I have never worried about my children. Go to hell. No, I have never listened. Every time when mother comes or parents, what they say that, doctor, I'm worried about my family. I'm worried about my children. Now, this is very common thing. But how to interpret it? The interpretation is that, first interpretation, why do you worry about children and what for? What is wrong? Doctor, because these days I'm so sick. I never could do things for them. So I'm worried that how they will survive, how about their future. So what we do then, anxiety, family, future about. So we are too much, keen to make rubrics rather than try to understand why to worry. What is the problem? Sir, I don't want to die, because if I die, who will look after you? Who will look after my family? Somebody will be there to look after your family. You can die peacefully. What is the problem? You want to die or you don't want to die? I don't understand. No, doctor, I don't want to die. So why you are putting children in between? You don't want to die. Say, doctor, I don't want to die. I want to enjoy my life. Why you are putting children in between? So this is, sometimes the patient has no clear idea what to tell the doctor. So what I make, so what I am, I'm a physician. So what is the role of my physician? I'm a bridge. I'm a bridge between patient thought and the clear idea. So my job is to give the patient a clear idea about his thinking. You are thinking, no, this is a bad thinking. No, doctor, this is a good thinking. No. This way of thinking is not very good for you. But doctor, I can't live. Every time in the morning I get up, the first thing comes, how my children will survive. Now, this is the center of the case, not the rubric of the case. Now, the thing is that first we have to, further on, I will tell you what is the center of the case. Today, the role of the center. That, I don't know how many of you really work on the center. I don't know. Just tell me, if you really look into your case about the center, if you are focused on the center of the case, which Dr. Sehgal has promoted from the first book, look into the center of the case, but we don't know where is the center of the case. And we are not worried about it because we are a rubric factory. We are going into making rubrics every day, morning, rubric factory. But where is the center? You are making a rubric for a center, or you are making a rubric for a just general words? Dr. Atish, do we focus on the center of the case first? After the case taking, this is the center.
Yes, sir.
Okay, so every time you center, if a patient is coming for cold or cough or anything, you look for the center of the case by mind or in the case.
Trying to
Every time.
bridge.
Okay, I don't know if you do every time or not. So now what happened that this is the fault. As a physician, we assume, this is what a patient want to say. Oh, I know now the patient. Now patient is very poor. Patient is delusion poor. Patient is that. Patient is that. But patient has no concern about. This is a small concern about the patient. We miss it. What we miss? Patient's concern. Why he has come to you. What he wants from you. Doctor, I want to get better in 5 days. Oh, carry desire to be fast. If he said so, if the patient says, I want to get better in fast, no, he just mentioned 5 days, nothing else. Doctor, I want to get better tomorrow, carry it fast. But did he say carry it fast? Did he say by words? No, he just said tomorrow. You don't have to agree. It's up to the doctor to agree or not to agree. So the doctor say, now my job. Patient say, I want to get better by tomorrow. So my question is, why tomorrow? You can see, I can't promise that you will get better by tomorrow. Maybe after 5 days. Why you want to get better by tomorrow? I don't know. No. Now this patient has to make me understand why he want to get better by tomorrow. So you have to restrain yourself from making rubrics. Please restrain, stop. First stop, listen. Why you want to get better by tomorrow? What is the urgency? What is the urgency? Why you want to? What for? Oh, doctor, you know that tomorrow it's a very important day in my life. Okay, what is so important? You know, doctor, my mother is coming. Okay, so why you want to get better by tomorrow if mother is coming? I mean, what is the relation of your mother is coming? You know, doctor, tomorrow is a very important meeting. Now, what is the relation of important meeting and your problem? I don't understand. This I don't understand, and this patient has to make me understand. Doctor, first impression is the last impression. If somebody see me that I'm so sick, what impression they will get? That's why I want to get better tomorrow. Are you getting my point? Yes or no? This is my way of case taking. Gursevak Singh ji,
Yes, sir.
are you getting my point? Because your name is Sevak is there, so you have to be Sevak of patients. So you have to understand, maybe you are new, I never saw you in the lectures. Okay. So here the physician has to focus. Now, the first thing for a physician is to focus on patient's concern. Maybe this is a good idea for you. Now, patient makes some sort of comment about his sickness. It is not that the patient do not tell us their problem. Now, in the last seminar in Delhi, few participants, they say, doctor, patient doesn't speak anything. He doesn't give any mental symptom. What should we ask? He doesn't talk. Why the patient will give you the symptom? It is your job. You are getting money also. It is your job. It's your skill. You have to develop the skill. I can't expect the patient to give me the symptom. See, I am the physician. I am taking money. I'm the service provider. So if you buy a mobile phone, it is the provider problem that he should give you the phone or the connection of the company, better connection. So it is my job. It's not the patient job, but it is our unwillingness. Now, the problem is because we are not trained in such a way to understand the patient. We are running for totality. So totality is very easy. You can ask here and there like a garbage and collect it. But what a patient concern, we always say the word unwillingness to listen, because we are unwilling to listen. Our inability to recognize the value of what they say and put it into proper perspective, which is to be blamed. We have to be blamed because we never try to recognize. Sir, it is very difficult. When I ask the patient, he doesn't speak. So where are your own skills? You haven't developed your skill over the years. You are just passing, it's like copy and paste life. So what we know in homeopathy, it is written in the book, okay, this book, which I'm giving you now. What we know in homeopathy, it is the man and not his disease that is to be treated. Okay, well, we all know about it, but do we really follow this? That is the question today. Now, according to Dr. Sehgal, in other words, it is his mind and not his physical condition that is to be balanced. Now, what we learn in the books, it is a man, not his disease, okay? And what Dr. Sehgal says, it is his mind and not the physical condition. So just a little bit modification, not entirely change. That is to be balanced. So where we have to find the balance? Mind. If the mind is balanced, everything gets balanced. In seeking a corresponding balance in the physical as well as mental state. Now, what is innermost in man? According to Dr. Sehgal, there is nothing more innermost in man than his mind. So what we are looking for, innermost. Innermost means what? The many patients who overhear from here and there, they gather the information, they come to us with the hope that their problem will get better. Mr. Kamal Chandra, could you please pause because you are noisy. Mr. Kamal Chandra Mandal, you may mute yourself, sorry. Okay, what is innermost? Which Dr. Sehgal started to understand. Have you ever, for example, a patient is coming to you for fever, viral fever. Do you try to understand innermost in the cough, innermost in fever? Maybe not. Maybe you never thought of that. I have to understand what is innermost in the mind of the patient who is suffering from viral fever for the last days. No, we start treating him. We want to make him better. This is a challenge. In 3 days, I have to make him better, otherwise he will run away. This is innermost of the physician. We are worried about our own innermost pocket, money. What is our innermost pocket? How much I earn in the day? We never go and focus on the innermost in the man. Now, what is innermost in man? That is his mind. It means that we have to locate where is the problem in the mind of the patient. कहाँ फंसा हुआ है patient? ये कहाँ फंस गए हो? Sir, I will not survive. If this is innermost, sir, I don't want to die. If this is innermost, no, sir, this is not innermost. Now, innermost is something which is coming as a root. Your patient is telling you, doctor, please cure me from root. But we ourselves, I have no idea where is the root, because innermost is the root. Innermost in the man is the root. We have no idea. But we are treating from the root. Sir, I am suffering from diabetes. I want that my diabetes should go away from root. How? No, I have no idea how diabetes can be treated by root. I have no idea. Because my job is to first find the understanding of the man, innermost. What is innermost? Then the word comes center to periphery. This is a very, I think, ignored, one of the ignored. Only we study when in the college, center to periphery, and we talk like a, buying a Coca-Cola, nothing else. I think, have you ever see a case, acute case? We like acute cases because it's very good earning, and we talk that, oh, I solve acute cases like this, one remedy, da, 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 finish. But if you really think about center to periphery in acute case, chronic may be possible. But we are not worried about anything. We are just worried about giving result. So whoever is giving good acute result, he is the best teacher in the world. Just run to, sir, could you please tell me how to solve acute cases, because I also want to solve. Because we don't want to learn homeopathy. We are behaving like a allopathic practitioners. Sorry if I'm offending somebody, but this is a collection of my knowledge. Now I understand center to periphery. Dr. Sehgal tried to understand center to periphery. How will you move the thing from center to periphery? What is the center first? Where is the center in the body? Then you go for periphery. This is English word. Now the disease must start moving from mind outward to physical. This, according to Dr. Sehgal in this book, he mentioned very clearly. So the starting point from within outward being the mind. So it is right to call mind the center. So center, according to Dr. Sehgal, is the mind. So it means that when Dr. Kent says, when everybody agreed in the past that mind has to improve first, it means that they invariably understood that the mind is a center. But nobody has mentioned it except Dr. Sehgal mentioned it clearly. That, okay, let's start the mind. See that when we give the medicine, the things will move out in a way. For example, if something has to come out from intestine or from vomiting, or something has to be done, but first mind has to improve first. Why mind has to improve first? What is mind? Now, mind is a source of energy, power. Mind is a power. You know that, for example, if a patient is not able to vomit, okay, and he's restless in the chest because the things are not coming out. He's trying, he's drinking something, he's trying, he's restless, he's moving around. Why the vomiting is stopped? Why the body is not throwing the material out? Because the mind is dull, mind is not activated. So when I give the medicine, I'm not giving the medicine to promote the vomiting. What I give that the medicine so that the mind should start functioning in this way, that it promotes the system to throw out the bad material out. This is called center to periphery. Now, again, we always want acute. Those who are successful in acute, he's the best doctor in the world. Rest are stupid. So acute, I solve acute cases. Okay, you can solve acute cases. Even allopathy can solve the acute cases. So what? I mean that if you take paracetamol, if you take any medicine in 4 days, you will get better. Also, you will make a patient 4 days better. So what you have done differently than others? So the first thing is that according to Sehgal method, there is nothing acute, nothing chronic. We treat the patient at the same level. So, but in this book, Dr. Sehgal has written in the third edition of number 1. I don't know if you have third edition or not. Coming and going by itself without the aid of medicine. Now, for example, a patient is coming to you for cold. Ask yourself if we need to prescribe the medicine. If every time a patient comes to you, we need to prescribe the remedy. Can't we tell the patient to go away and wait for 2 days? Your acute state will go away because it's a cold. Normally in 2-3 days, it will get better. Nothing to do. But why do we prescribe a remedy to an acute patient? For example, he has eaten something and patient has indigestion and he has diarrhea. We give the medicine to stop the diarrhea, but we should not stop the diarrhea. This is what we taught. We let the discharge come out. We should not stop it, but we give the medicine to stop the diarrhea. And we are happy next day when the patient says, my diarrhea has stopped, and we say, wonderful result. Oh, I am the successful human being in the world because I gave the medicine and diarrhea stopped. Are we supposed to do this? No, we are not supposed to stop the diarrhea. We have to understand that what is the problem with the diarrhea. Doctor, you know that my energy level is low. Or I'm getting, that I have no motivation to work. I'm lying in the bed. I'm so, that dull. Now, these symptoms, which are associated with the diarrhea, tell that the person is in a sick state. Why we look for the diarrhea? Why don't we look for the sick state of the patient? Because we are not trained. We are only trained to listen, cold, acrid discharge. Okay, give him L.M.C.P.A. This discharge, give Merxol. I have never given Merxol in my life. Never, I don't know how to give it even. I have never given L.M.C.P.A. I have no idea how to give it. I give it, but on the mental state. I have given all the medications. So the first thing is that if you true lover of Dr. Sehgal, please follow his studies. What he want to say, that we are not here to stop the discharges from the body. If a patient is suffering from acute nasal discharge from the coryza, and we give the medicine thinking that, doctor, sir, I gave the medicine, and tomorrow the patient says the discharge stopped, no nasal discharge. This is wrong, because what happened to the center? If center is calm or not, if the patient says that, doctor, okay, my diarrhea is stopped, my this is stopped, my fever is gone, but my center is still disturbed, this is a wrong prescription. So the first center has to calm down, and then the physical has to be calmed down. So denoting thereby that the body along with the center is full control of situation and is capable of managing the show independently without the help of external aid. In acute, why to give medicine? Because if the center is okay, for example, okay, I want to prescribe also on the acute cases, but why? When I will prescribe? For example, a patient comes to you and he says, doctor, I have a fever, I have some stomach problem, I have this physical problem, but you know that apart from that, I'm able to work, I'm able to move, I have full energy, maybe little bit, but I think that I'm managing. So I just come to you to know if I need medicine. So patient is not demanding the medicine from you. He's just asking if he needs medicine. So in this way, I can say, okay, if you think your body is able to fight, wait for 24 hours. You can report me tomorrow. And then I will see if you want medicine. So in every case, I look for the center. If the center is disturbed, then there is a need to give the medicine. If the center is okay, there is no need to give the medicine because it is only a peripheral problem. Center is okay. Now, what is chronic? In it, the body along with the center is struggling. In the chronic situation, what happens? Mind is struggling because the problem is grown too much. Maybe the stupidity of the patient that he ignored it in the beginning and he did not go to the doctor in the first phase, and he allowed, or sometimes the problem appeared all of a sudden. against the disease. So center struggle in chronic, what happened? Center is struggling against the disease. So whenever something physically happen, the center, like hormonal disturbances, everything in the center get disturbed. Our hormone get disturbed because they are not discharging properly. It's calling for, now the center says, go to the doctor and take the medicine. Maybe you are not clear here. For example, a patient comes to you and he tells you that, doctor, I have been suffering from last 5 days, but my mind, according to my mind, according to my experience, I thought it's a normal thing. I don't want to take the medicine, or I did not push myself to go to the doctor. Today I thought that I want medicine. Why today you thought? So who has brought the patient to you? His own thought. So where the thought, appeared in the mind. So the mind has guided him. Okay, I'm struggling to manage the life. I'm not able to fight anymore. Go to the doctor and take, or do something, yoga, meditation, or whatever you want, but do something, because it doesn't find itself in a position to meet that demand on its own. Now, in chronic, what happened? The body and the mind, they together struggle to cope. That's why interference of the medicine is needed. So the disease, which is posing a challenge to the center, seems to be stronger, thereby putting the whole body into danger. So what happened in the chronic? The challenge is going to the center, and everybody struggle, and then it's a danger state. So like physical symptoms, the mind symptom could change in acute or chronic ailment, but the mental state remains the same in both the situation. Now, friend, you prescribe the remedy Bellator. First of all, for example, I hear a case. Sir, I given Pulsatilla, my patient got better. Well, very good. Your success is, have to be applauded. Very good. On which symptom you gave Belladonna or Pulsatilla, for example? Sir, I collected 5 rubrics and I gave the Pulsatilla. Okay. What is the best part for you to give Pulsatilla? Now the physician has no idea what is the best part out of 6 symptoms, which is the best part for him, which is the center. Now, I asked that when a patient told you that he has got better, have you asked the patient about this 6 mind symptom which you have collected one by one? If this symptom disappear, or he is still suffering from one of the mind symptoms which you have collected. So every time what happened, that most of those who prescribe on mind rubrics, in the follow-up, they look only for the change at the physical level. They seldom look for the rubric which disappeared or not disappeared. For example, a patient says, my 4 rubric disappeared, or he doesn't say rubric, maybe he says 4 mind symptoms disappear, but 2 still are remaining, and physically he is completely better. Now, what about those mind rubrics which are still lying in the mind? What to do? That is, you have not covered the totality. So the medicine which you have given has not covered the totality. It's a partial. Now, what should we our approach to understand the feeling of a patient in minimum time and without exhausting him? See, what happened most of the time, the patients are worried because they like to go to a doctor who takes 10 minutes. Now it was many years ago, maybe in 2003, I went to Austria for lecture. From the airport, the organizer, she told me that we are unique. And maybe my bad English, I have no idea what is unique means about us. She said, it is very famous now in Austria, as you have come, that everybody is talking that, oh, their way of prescribing is unique. Okay, so after I gave the lecture,
Hello.
I promoted Sehgal method, like it's a quick, it's a minimum time we take in the case, maybe 10 minutes, 15 minutes. We don't exhaust the patient. So few of the practitioners, they come to us and they say, doctor, this will not work in Austria, because in Austria, we minimum time we give the patient 3 hours, maybe 4 hours. I say, really? Patient give you 3 hours for the case taking? Yes, we have plenty time. We have plenty of time, not like India. So India has come in between. So what is the India has to do with the case taking? No, in Austria, we have plenty of time. And how much you take from the patient for 3 hours? We take $500. Oh, it's a big money because in India, nobody gives 50 rupees. Even if I give 3 minutes or 33 hours, price is same. So why should I give 3 hours when I get 50 rupees? So I can, in 10 minutes, I get 50 rupees. In 3 hours, I get 50 rupees. Maybe in 3 hours, I lose the patient. But in 10 minutes, at least the patient says, okay, you have saved my time. So it is entirely different. Today, I'm going to show you one very good examples today that how Europe is different from India in their approach of it. So my method failed in Austria because they say, oh, maybe you are right, but we don't want to give minimum time to our patient. We have luxury of case taking. Sometimes we give 7 hours also. Okay. So I never got invited again in Austria. So while prescribing a medicine, it is important to track down or find out the present state. Now, from center, maybe you understand. See, center is two types. One is center is mind, and then the center is to localize where is the center of the case. So there are two center, mind and center of the case. Every time when a patient comes to you, I look for where is the center of the case. I mean, to look when you are talking, you have to say, this is the center of the case. The patient says, no, this is not exact idea. This is why you have come to me. Not exactly. Okay, this is not the center. This is why you have come to me. Yes, doctor. This is exactly you caught me. So what happened that sometimes we are too quick and sometimes we are too far from the patient. We never reach to the center of the patient. Now, if you don't hit the center of the case, so what happens? The case will linger on. The patient will come back to you again and again and complain that, doctor, your medicine is good, but not similarly. It helps me, but not entirely. So the second point is present state. Now, what is the Dr. Sehgal says in this book? Please read it. Again, I'm showing this book. Okay, maybe you have not read it or read it. I don't know. And how many times? Because I modified this book again. This is a 2020 edition now. So I have made some editions also. So we are modifying our books because I understood this book that there are some hardness in when you. So you know that when you go to school, you bring your textbook with you. Why you bring your textbook with you and there is a teacher? So why you need textbook when there is a teacher? Because teacher explained you about the textbook, that what is written in it and how to understand it. So this is the way I'm showing today. Now, why prescribing? This is another, one of the biggest seller of Sehgal technique. Everybody says Sehgal technique, present state. Sehgal technique, but nobody says Sehgal technique means center. Sehgal technique, present state, rubric. That the two things, and Sehgal technique is finished. But friends, this is not the way. It is entirely a Pandora box. We are a box full of knowledge and information from many things. So while prescribing medicine, it is important to track down or find out the present. And that is the exact point of take off in the reverse direction. It means that what is present state? Today, what we learn from classical, they go from here to present. What we do, we start from present and go in a reverse order. It's not that I'm not following the reverse order. For example, I ask the patient, today you have come to me for problem A, B, C, D, okay? And this problem today, for example, asthmatic attack. A patient says, I have been suffering from asthmatic attack from the last 20 years. Well, good. Shall I start from the 20 years? Shall I go back to 20 years or shall I start today? So I start today. So today, what is your problem? Today, nowadays, doctor, from the last 1 week, I'm suffering and the allopathic medicine is not helping me, which used to help me. Now I've exhausted all my sources. So I decide, let me start something else. So somebody told me to go to homeopathic treatment. Now, this is the journey of the patient to visit you because somebody referred. So patient has come to you from reference, not by his own idea. It is the idea put by somebody in his mind to go to homeopathic treatment. Okay, so well, you have come to me today. So I collected the information from this attack first. Okay, the last attack, since many days, what you have done. So what do you feel now? What is in your mind now? So I talk about present state. State means complete 1 week process. this 1 week Pandora box. So in the 1 week, what has happened with you? Why this medicine has not helped you? Allopathic medicine, which have been helping you for the last 20 years. Now, 20 years, same medicine, same patient was helping him. Only thing which has changed is in the last 1 week, allopathic medicine failed to help. So something has changed now. In this present state, last 1 week, something has changed. We don't know what has changed. So we have to clarify from the patient what is the change in this 1 week that allopathic medicine has stopped working on you and you are getting more worse and the attack is getting more severe. What is the problem for the patient? So this is called present state. So in the present state, physical part as well as the mind part come together. And in the collection of the things, we go in further down to understand what is the present state of body altogether. Now, present state of mind means center. That is to be considered, evaluated, and accounted. Now, how to consider is how to evaluate present state of mind. This is also written in the book. Now, medicine prescribed exclusively on the present, predominating, and persisting symptom of the mind. That is another 3P which Dr. Sehgal has given, and everybody is using as if they have discovered it. And everybody is now, somebody say, present is good. Even many teachers, they start to say present is good. Earlier, they were disagreeing with Dr. Sehgal's idea. He had to struggle a lot. Past event, be they physical or mental, are disregarded unless the patient makes mention of them. For example, a patient had a problem when he born or in the childhood, during the college time, after marriage, before this, before that, and he completely forget about it. It means that idea has nothing to do in the case. Sometimes we are digging, we are probing a patient too much. Please tell me what happened after the marriage. Please tell me what happened when your father died. Whatever happened, when the patient says nothing happened, it's not that the patient is insensitive, that his father died and he did not make any reaction. No, this is not true. The idea is that it is not his idea now, because he's not interested in giving you information what happened in the past, because it has no relation with the present problem. Sometimes the patient, for example, I heard from the patient that he visited a doctor, homeopath. He asked him certain question which has nothing to do with his present ailment. So he asked me, doctor, why that doctor asked me such questions which has nothing to do with my present problem? What he needed to understand from me. So sometimes the patient also very, intelligently, or they understand that something which is useless, why to probe it today? So, so what we do that, let it be known that it is currently bothering him. Please understand the word. Whatever we take today, even if that problem is there persisting for 20 years, but if that thing is currently bothering him, for example, a patient says, doctor, 10 years ago, my neighbor did something wrong to me. I could not forget that. Still, whenever I get sick, understand, please quote, I quote, whenever I get sick, that thought renewed or reappear in my mind. Oh, my neighbor did something wrong to me. What is the connection of that to your case? I don't know. But whenever I get sick, maybe cold or maybe fever or maybe cough, the same idea appeared in my mind that, oh, why my neighbor did to me. And that idea, I got better. 10 years I've been taking homeopathy, allopathy, Chinese, this. Every time I get better. But this idea that my neighbor did something to me reappear every time I get sick. Now, this is the center of the case, which nobody removed. Nobody thought about it. That this may be a cause of sickness, but nobody tried to understand, or they put in the dustbin. Okay, neighbor said something, so what? Now, I asked the patient that, okay, why this point is bothering you every time you become sick? Why? Why you think of neighbor did something wrong to you and how it, bothers you? Oh, doctor, I don't know. I get, so much hot with this idea that how could he do it? How could he did to me this? How can he do this? I want to do something against him, but I never could do it. Why? You finish the matter. Once you get better, you must finish it. Okay. Now, with regard to the mind, it is essential that it should start improving first in each and every case. It is so far for the physician to recognize. Now, it is our job to recognize. Mentals are not given, not even taken, but are recognized. While talking and expressing one's view about anything, whether it is sickness or anything else, an individual exhibits mental condition. Now, it is again the job of the physician to recognize. Now, what I heard from many seminars that the participant would come to me that they don't recognize the mental state because the patient doesn't give them. No, this is your own failure. Now, belladonna, which is one of the highest promoted remedy by Dr. Sehgal only, maybe also from other teachers in the past, we never knew it. This is another of Hahnemann's polycrest drug of many uses, which has its own place in every homeopathic medicine chest. However, diminutive, because belladonna is considered small, one of those medicines without which we might indeed shut up shops. And who said so? Margaret Lucy Tyler, the best Materia Medica. I love it. If any one of you have read this, have the book from Margaret Lucy Tyler, anyone? I love this Materia Medica. This is my favorite book. And this book is still available on Amazon. You could buy it. It's around 300 rupees. And what is the best part of this lady? Okay, she was the student of Dr. Kent. Maybe you don't know about this book. And what she did that she studied Hahnemann very well. She studied Kent very well. She studied the idea of every homeopath and clubbed in her book together. So that's why I like. And according to her, if you don't know belladonna, shut your shops. And it is written 150 years ago. And Dr. Sehgal says then it's wrong because it is Dr. Sehgal idea. No, this is not Dr. Sehgal's idea. Dr. Sehgal has taken the idea from the authors. They written that what is the best part of Dr. Now, what Dr. Kent says about belladonna. It is the marvelous drug, but difficult to use. And Dr. Sehgal has made this drug so easy to use that every homeopath can start their practice with belladonna. It is not our favorite. It is the one of the medicine which a patient describe, because why Dr. Sehgal says belladonna is 40%? Because he understood that humanity in large behave like belladonna when they become sick. So we are not giving belladonna to a pulsatilla patient. We are not giving belladonna to a sulfur patient. We are giving belladonna to a belladonna patient only. Just I wanted to make you awake that please, if you are a true follower of Sehgal method, please read this book. Please, I tell you, please read this book. Without this book, you are useless. Go through this book, read again 3rd edition. So bye-bye. Thank you very much.